only it's not to public. Only I will share the link with you, with the one with link, then you can watch.
Okay. All
Yes.
right. Okay, great.
And that's, so for this session, we have every second week or sometimes every week, depends on the time. You can see from the schedule. For this session, it's just going to have a simulation. So in this session, I'm going to be the patient. You guys can be the doctor. You as a group, you're going to take case from me, and I'm going to give you some information according to your questions. And afterwards, you're going to discuss. You need to give me the diagnosis, differential diagnosis, the syndrome differentiation, the syndromes, the treatment plans, and then that's basically to simulate what happened in the clinic.
Okay.
Okay.
So this is a patient, a gentleman, 65 years old, and the patient feel like the left side of the body does not function well. It's weak.
Okay. So we can just start by just ask you questions.
Yeah.
Okay.
And you have 10
So-
minutes.
Okay. So
Wait.
how long has he
And-
been feeling like this?
Only half a day. So from last night, 12 hours.
12
Okay.
hours. 12 hours ago. Okay. And what happened 12 hours ago?
I don't really know because this happens while I was watching TV.
Okay. Did anything happen before that?
No. So while
No?
watching TV, and then all of a sudden I feel like the saliva is towards the face, and then I realize my arm doesn't move well.
So
Just
you
your
have
arm?
weakness of your arm
Hmm?
and your weakness of your arm
The arm and the legs.
and
And the
leg
leg.
on the left side.
Yes.
Is your speech affected in any way?
The speech is still fine.
And your mouth, is there any paralysis or deviation on your left side of your face or your eye?
I can't see. It seems it feels different, but it looks normal. I
Okay.
feel
So only
different.
just
Yes, only the drooling.
okay.
Okay.
And
Are
did
you-
anything
Sorry,
Did
Angie, are you still drooling? Okay.
Did anything happen before the weakness set in? You know, either early in the day or the day before, or even the week before?
Nope.
Nothing.
Nothing.
And no other symptoms that were related to this. You didn't feel anything else, dizziness,
Headache?
I have slight headache.
Okay, wait. What was that?
Headache.
Headache.
A little bit of headache.
Okay, so do you still have a headache?
Very mild.
Mild. Where's your headache situated?
It's the entire head.
Entire head. And what would you rate your headache out of 10?
About 2.
Okay.
1 or 2.
Okay.
so quite mild. Okay.
Yes.
Did you see anyone else for this other than coming to see us today?
Nope.
So you
So
haven't
you
had
didn't
any.
go to hospital, haven't gone to anyone else? We're the first people that you're seeing since this left-sided weakness.
No, I haven't.
Okay. Do you have any medical conditions, blood pressure, cholesterol, any other chronic conditions we need to know about?
Yes, I was diagnosed with hypertension.
Okay. Are you on medication for that?
Yes.
Okay.
And you take those medications daily?
Yes.
Okay.
Is your blood pressure being under control as far as you know?
It should be under control.
Okay. Any other medical conditions besides the blood pressure?
No, I no.
With the left-sided weakness, do you have any pain or tingling or numbness?
Nope.
What can we see on physical examination of the patient?
Only the leg, no, not leg, I mean less muscle strength from your physical examination. on the left side. So the patient cannot move arm properly, cannot grab properly. And when you can see the patient walk, the walking is running is not as normal, it's weaker.
So the patient is walking.
Yes, walking with walking
Walking
sticks.
with a walking stick. Okay. Walking.
Is there any change of sensation in the arm? Can the patient still feel touch?
Yes, the patient still can feel.
And even if you test with something sharp, the feeling on the left and right arm or left and right leg is the same.
Yes, still this. I would say less painful as the right side.
Okay.
Not as sensitive as the other side.
Yeah.
But
So
the patient
there's
still
like
can, yes, still can feel.
a decrease in
Okay.
sensory. Okay.
And what about your appetite?
The appetite is normal before, but from last night until now, I don't want to eat.
And your thirst? Are you thirsty?
Nope.
Are you normally a thirsty person?
Nope.
Okay, so no change.
Okay. And sleep? Were you able to sleep last night?
Yes, the sleeping was disturbed, but in general, I don't sleep well, always disturbed.
So that's normal as well for you.
Yes.
Okay. And any change in your bowel habits this morning? Or
Nope, it's normal. Same as usual.
Okay. Is there any history of stroke, blood pressure, heart attacks in your family?
Hypertension, not stroke, and not the rest, only hypertension.
Hypertension family history.
are you also on cholesterol medication, or is it just hypertensive medication?
Only hypertensive.
When you had this loss of or the numbness or the weakness in the left side of your body, was there any medication or any tablets that you took at the time?
Nope.
Okay.
And have you ever had this before?
Nope.
How does the patient's tongue and pulse feel?
Yes,
The
I can ask.
tongue is a red tongue. The pulse is wiry.
Does the tongue have a coating?
Some yellow coating.
And the shape of the tongue, is it small? Is it swollen? Is it tender?
Seems normal, not nothing specifically.
Is there
You had-
deviation of the tongue?
A little bit, yes.
To which side?
I can't make out of my mind now.
If it's a left side, isn't it going to go to the right?
Yeah. Does it go
The
to the
left
other
It'll go,
side?
it'll go to
Either
the
way.
strong side. It'll go to the right.
Either
I
way,
think.
left or right.
It's deviated. That's all that counts.
Yes.
We've also got to challenge you sometimes, Doctor Who.
Yeah, great.
Okay, and a wiry pulse.
Yes.
Okay.
Did the patient have some kind of emotional upset in the last day or two? Fight with his wife, a problem with a neighbor,
really.
nothing like that.
Not really.
And he's not an anxious person or easily angered.
No.
No?
No.
And what is the patient's pulse?
Of course, wiry.
Okay, no, but sorry, heart rate.
Heart rate about 75 beats per minute.
Temperature?
Temperature is 36.8.
Okay. And his blood pressure is normal currently.
Yes.
Okay. And on the sort of neuro exam, motor, sensory, his reflexes are all normal?
Oh, sorry, what reflex?
Like if you go on the bottom of the foot, I think it's called
I've
the
skin
Babinski.
those are all abnormal, so it matched to abnormal.
So they were abnormal.
Abnormal, yes, like positive.
Okay.
In terms of the patient's appearance, is there any color that's distinct in facial complexion, any redness, red cheeks, anything that's distinct, red eyes that we
No.
need to be aware of?
Nope.
And no strange taste in the mouth?
No.
Is the patient feeling, are you feeling emotionally, is there any emotion that's feeling very distinct at the moment?
No.
No anxiety?
No, maybe stress from the lack of movement.
Okay.
How is the patient's diet usually?
It's quite healthy.
What would you normally eat on an average day?
Mostly vegetables, some meats, and some rice. In general, I mean, it's quite healthy and not oily.
So not oily?
No.
The patient's physical structure, are they very thin? Are they overweight? Are they muscular? Are they weak or flaccid?
I would say like normal, not too
Okay.
skinny, not too fat.
In terms of the weak side, is there any spasticity, abnormal movements?
What do you mean?
So, for instance, is the patient very fixed and like spasm, or are they very weak
No.
and flaccid?
No, weak.
So the arm and the leg are on the left side are more weak and flaccid.
Yes. You have 1 more minute.
And any dizziness?
Dizziness? No.
And any ringing in the ears?
Nope.
Any blurry vision?
Nope.
And what about sweating?
Yes.
Sweating, also nothing special.
Okay. That's all I can think of.
And what about urination? Any change there? Volume, color?
No changes. The body is normal, the color is light yellow. Cecilia, do you have any questions? One last chance for you. You were quiet.
Nothing comes to mind now, Dr. Yu.
Okay, great. Now I'm going to give you 10 minutes. You can use this platform to discuss. If you need more time, then you can have 15 minutes. Just keep for 10 to 15 minutes. But in the meantime, I will be here. If you finish earlier, then let me know.
Okay.
What you need to discuss is the diagnosis, the differential diagnosis, treatment principles, and the prescription, and also patient advice.
So we like literally doing the case like we did in the clinics.
Yes,
We're taking
exactly.
a full case and we want to give it back to you.
Exactly the same, just you don't need it.
Yeah. Okay.
Okay. With diagnostic tests, I feel like the man should have a CT scan or something to see if he's had a stroke, to see if it's a hemorrhagic stroke or ischemic stroke.
Yes.
Don't know what you, yes?
We haven't really established that.
We
Yeah,
haven't established
100%.
it all, yeah.
Yeah. No CT.
Yes,
So you definitely want to do a referral
Yeah.
to a hospital to do a CT scan so that you can establish, yes, whether it's ischemic or a hemorrhagic.
Yeah.
Or hemorrhagic. It doesn't seem to be hemorrhagic because he doesn't have that severe sharp shoot,
Yeah.
that severe.
And hemorrhagic, there might be like vomiting or nausea, sudden,
Yes.
abrupt, very severe headache. His headache's very mild. So if it's going to be anything, it might be more ischemic. It could also be a transient ischemic attack. That
Yes.
usually recovers though within sort of 24 hours, but now it's only been 12, so we won't know.
Yes.
That could
Yes,
be listed as a differential though.
Yes.
Yes. Good one.
So TIA is a differential.
Yeah.
Okay.
I think we can. Sorry, should we say something like a trigeminal neuralgia for a different differential for the face as well?
Could be.
And we can do.
Or
For a
facial
different-
paralysis or something.
Yeah.
So facial nerve, maybe.
Yes,
If
facial
it was
nerve.
trigeminal neuralgia, why would there be involvement then of the limbs?
But that's how you exclude the differential.
You've got to verify
Yeah.
then because the limbs are involved.
Yes.
Okay, got it.
Yeah, so you can say it's
Yeah.
not trigeminal neuralgia because
Because it's got involvement.
It's
Okay.
good to list it so that you've gone through that process of
Yeah,
thinking.
and you've got a reason why it's not.
Yeah.
Okay.
Correct. Yeah. And I mean another differential could be brain aneurysm, but that's also more sudden.
Yeah.
Yes.
I would have thought the person if you have a brain aneurysm, it's sort of like very sudden. You'll literally just fall down. You might have lost consciousness. Where this man didn't seem to have lost consciousness at all.
Isn't
could
wouldn't
be-
that fall under hemorrhagic? Wouldn't the aneurysm fall under hemorrhagic stroke?
Yes,
Or am
it
I
would.
wrong?
Yes.
We could say like a tumor for a differential as well.
What is it?
A tumor, like a
okay.
like a lesion, something
Cool.
cancerous.
So a brain tumor.
Yeah.
Okay, so then that could at least be excluded on the CT scan that we want to do.
Yes.
Yeah.
Okay. So with differential, we've got TIA and brain aneurysm, trigeminal neuralgia, brain tumor. Are we going to say stroke under diagnosis because of the deviated tongue? Is that what sort of?
I think everyone, I've definitely stroke without a doubt.
Yeah. But we can't
Okay.
say for sure. But I'm going to say it's probably an ischemic stroke, likely, right?
It seems like it.
Okay.
So
And then
let's just say
in terms-
stroke. We can't actually verify because we haven't done the diagnostic testing yet. So I think just do stroke, in my opinion.
Yeah. Okay. And then syndrome, I mean, just based on the
Tongue.
the being wiry and the tongue, there's
Excess heat.
excess heat, and then the liver must be involved.
But sometimes, if I'm not mistaken, a wiry pulse can also be from exuberant heat, not always liver. If I might be wrong though.
Yeah. Okay. And then I would think, and he didn't
Excess
have
heat.
eyes, and he didn't have red eyes, and he wasn't irritable. But
Yes.
but yeah, the tongue sort of makes me think liver yang, hyperactive liver yang or something like that. I don't know. What do you think, Marietta?
I'm actually wondering if it wouldn't be like deficient, like a red tongue with a thin yellow coat. Like, I don't know. I got the idea that he's like deficient in something, like he's lost his appetite, like, can't really move. Everything is flaccid. So I don't know why I get the idea of like a deficiency rather.
Okay, but then write what syndrome you think it is, because that's when we can all learn from, this is where we will think differently. I wouldn't say so. I wouldn't say it's deficient. I mean, you never know. Maybe there is a yin deficiency that's causing exuberant heat, but he doesn't show that in any of his signs or symptoms. He's
not showing a lot of heat stuff.
Yes, so I didn't.
And with yin deficiency, there should be scanty coating, not any kind of coating.
Yes.
There should be a thin yellow, or so in that case I would say maybe not, but it could have been from like some kind of yin deficiency that then became a hyperactive, heat.
Yes. I don't know how you girls think, but my train of thought, just looking at it off the bat with the red tongue with the thin yellow coating, is exuberant heat. I think that the heat would cause some sort of blood stasis, because at the end of the day, a stroke is due to blockage. There must be a blockage in circulation of chi and blood. And am I right that the excess heat can do that?
What
Am I right?
Yes, the exuberant heat can cause blood stasis.
So, but if there was blood stasis, we would have like a purple tongue or, like a choppy pulse or,
Correct.
sweating, stuff like that.
Yes.
What
True.
about if it was exuberant heat resulting in phlegm causing a blockage?
The thing is, I don't see any signs of phlegm though. Do you girls, or did I miss it?
No,
No.
I mean, on the tip of the pulse, there isn't greasy or slippery, so that would, that would
There's no
normally.
swollen tongue, no teeth marks, because it is a common cause of stroke, the phlegm.
Yeah.
But I think in this case, but I might be wrong, Cecilia. I might be totally wrong. It's a very valid point.
I hear you. I was just making a suggestion.
Yes. But
No,
it could
definitely.
absolutely be. Because I think I've always in my mind thought that's quite a common cause of stroke. But he
Yeah.
also said that his diet seems pretty decent. If it
That's
was
also
maybe a obese patient that maybe
Yeah,
had
and
more oily food,
Yeah.
I think
Yes,
maybe, yeah.
Fair
But
enough.
that is a good
What if-
point.
What if the exuberant heat is causing wind? Because stroke is usually is supposed to be
Yes.
pathogenic wind.
Good
caused it.
one.
Would you
So if
not
there's
see
heat-
a tremor with the wind?
Yes.
We didn't ask. We didn't ask. Is there a tremor? And there might have been.
Well, I asked
so,
if there
You
was
did ask about
spasticity
spasm.
and movements. Yeah. And he said no.
Mm.
oh, okay. All right.
But that's a very good point. That's a very, very
Okay.
good point.
Okay. Then
So-
what do we go with for the
Syndrome.
syndrome?
Yeah.
So it's, I'm going to say definitely, I'm going to say excess heat or exuberant heat.
Yeah.
Probably the most
And
likely.
then what do we say? Excess heat blocking
And
the vessel.
what if he had, like Marissa said, liver and kidney yin deficiency, but then there wouldn't be a coating, right?
He doesn't show anything clinical that indicates a deficiency at all, in my opinion. I might be wrong.
I'm just thinking about the loss of appetite, the weakness, that I think
Yeah.
that made me think of a deficiency.
Deficiency. Yeah. I hear you.
But his urine has no change, so he has a light yellow urine, and it would be decreased in volume if it was a heat thing, and you would also have constipation, red eyes, like you would have more heat signs. So I'm not necessarily seeing a lot of heat signs either.
No,
It's weird.
agreed.
Okay?
Agreed. That's why it's a bit confusing. Agreed totally. Thirst is also not affected.
Yeah.
There's no thirst. The bowel habits, there's not constipation, like you say, or dry stool. There's not a red face, red eyes. But if you go literally just off the tongue and the pulse,
Yeah,
regardless
true.
of that, indicates heat, which Dr. Hu always says we need to always, that is our primary diagnostic tool for the syndrome.
And for that, there's the sort of liver heat, because of the wiry and, just from those two, just look at that.
And the
Okay,
liver
so
heat would be what
let's
will
take
cause
that
the
for our
wind.
diagnosis then.
Okay, what are we going to say?
So we literally could go to that hyperactive liver young.
Okay. Causing wind.
Yes. Well, I don't know. We don't need to necessarily to say that. We didn't need to, remember what he told us in clinic. If the syndrome describes everything, you don't have to add stuff.
Yes.
So maybe the pathogenesis is explained, then you might say the wind.
Yeah.
And then what is the treatment principles going to be if we've decided it's exuberant heat resulting in wind?
So you would need to.
Okay. Can I make a suggestion, girls?
Yeah.
Because I don't agree with hyperactive liver yang. So I think
Okay.
what we must do, because this is how we're going to learn, I think everybody must choose their own syndrome, because now our treatments are going to all be different. Because
We can go with your diagnosis. We can go with your
but
diagnosis.
I might be wrong.
100%.
Maybe you're right, and then we don't learn from it.
Yeah, but he's going to tell us what it is afterwards if we're right or wrong. So, and then we can ask questions. So if you rather want to go with like a plain heat, then we can do that. I don't mind.
Yeah,
Just my
maybe
my train of thought. What do you say, Cecilia?
I would say I'd be happy to just select one and go through the process of choosing like our treatment principles, and then when we discuss with him, we can speak about the variations.
Cool.
Mm.
Because I don't know what you girls think, but my train of thought going here is like exuberant heat leading to a chi and blood stasis. Even though there's not yet a purple tongue, a stroke will always cause blockage.
Yeah, and
It would cause
only
a
being 12 hours in, maybe it's still leading up to that.
yes, might not yet be visible. So that's what I would say. I wouldn't go yet with anything. There's no emotional, there's no sighing. He hasn't had emotional upsets. There doesn't seem to be any, there's no nausea. There's, you know what I mean? There doesn't show anything, in my opinion, of liver as yet. But I mean, I might be totally wrong. I could be off the mark and you guys could be absolutely spot on.
And
That
what
is-
about liver yang rising then? So that it's not quite as like much as
I don't
hyperactive.
remember now when we did stroke. Was that one of the
Same thing.
etiology?
No, I don't know.
No, they
I
So
don't know.
I've got stroke open here before me. So our options are hyperactive liver yang, due to phlegm blockage in the meridians, due to phlegm heat, due to chi deficiency and blood stasis, due to internal wind, due to yin deficiency. That's our options. So it doesn't seem that there is
Exuberant heat
that
doesn't
something
cause
like
a
that.
stroke.
Yeah.
No.
So then you guys are spot on. Then it is yang. Then it must be hyperactive liver yang. Hence the wiry pulse.
Yeah.
Yeah.
Okay.
Yeah.
All right. Well, then let's do that. Sorry, girls. I was off the mark there.
No, but that's what we need to do. We need to hear all the different ideas, because it's not that one of us is correct. We need to.
Yeah.
I mean, I've learned a lot just by hearing what everyone else has to say. So
Yeah.
you know, the only way to do it is to say, what about this? You know,
Yes.
did we think? Okay, so then what are we going to say for pathogenesis explained?
Mm. So the hyperactive liver yang is it the exuberant heat?
Yeah.
But
So
doesn't-
hyperactive liver yang creates heat because yang is hot. Like yang is hot, right? So it would then create that heat, which could lead to, a blockage in the meridians. Because as you say, Tammy, I think I 100% agree with you. Like stroke is a blockage. So we need to
Well, it
add
doesn't have
that
to
in
be,
there
it could
somewhere.
be a bleed, right? It could be a bleed, so it doesn't have to be a blockage. But in this case, we're thinking it's a blockage.
Yeah.
I think in terms of the theory that we studied, I stand under correction, but in general, stroke is generally seen as a blockage of chi and blood. Am I right or am I wrong? But you are right, because if it is a bleed, it's a bleed. A bleed is a bleed. Then that would be hemorrhaging.
Yeah.
But
Chucksy.
maybe it's hemorrhaging because
So-
of heat, like the vessels have now burned.
Pushing the blood out the vessel.
Yeah, so it could still be derived from heat,
From
even
heat
though there's
anyway.
a bleed.
True. Okay. But then what would the bleed cause? Would that cause blood stasis eventually
Probably.
and blockage?
Or blood deficiency if it's draining. I'm not sure actually
Mhm.
in this setting.
Okay. So we're going to say that the exuberant heat leads to but how do we describe the pathogenesis of that?
Yes.
I don't know. I don't know
So-
this well. I don't know the hyperactive liver yang very well. I've forgotten it.
See,
So
hyperactive liver would be caused by either liver and kidney yin deficiency or excessive emotions. Now, he didn't have excessive emotions. We asked him if he had a fight and if he was angry and irritable. He didn't have any of that. So then back to what Marietta said about the deficiency. Maybe he had liver and kidney yin deficiency, which
And
then
that was the cause of the
caused the-
hyperactive yang.
you see. It's just that the tongue and the pulse are saying heat. Right?
Yeah.
Yes.
So if we have a hyperactive liver yang, the liver yang causes heat to rise, which can create an internal wind.
Yes.
That's
So
the
I
only
think
way
in
we could
terms of-
think of the wind.
Yeah.
Okay, let's go with that then. Exuberant heat causes what did you say then, Marietta? Sorry?
Internal wind.
Yeah.
So the exuberant heat rises to the liver and causes internal wind.
So it rises
then-
from the liver upwards and then creates like a wind with that movement.
Yeah. And then you can confirm the exuberant heat by the red tongue, thin yellow coating, and the wiry pulse.
Yes.
I
Okay.
stand under correction, but when there was hyperactive liver yang, wasn't the patient also though showing a lot of heat symptoms
Yeah,
as well?
red face and so on.
Remember,
She was saying-
we were still so
Yeah.
confused between hyperactive liver yang and what was the other one? The other liver excess heat one that was so difficult. We couldn't remember. It was
Yeah.
hyperactive liver yang and liver fire. Do you remember? It was liver
Yeah,
fire.
too. I think liver fire is more than hyperactive liver yang, I think. I'm not.
And then what
yeah.
will the wind do? Is the wind causing the stroke? What is there a blockage, or is that literally what we're dealing with?
Yeah, so wind, like wind causes something to happen to the blood.
So it's a
There was that
weakness.
theory of if you want to clear the wind, you must move the blood. or
Yes.
something,
Yeah.
right?
So then
it must be that the wind causes some kind of blood stasis.
yes,
Am
because it
am I-
must. There must be blockage somewhere. So then
Yes.
this makes sense. This makes sense as well, that the wind might cause a blood stasis,
Okay.
hence resulting in the stroke. Do you girls all agree?
Okay.
Yeah.
I remember somewhere in the theory, but I can't remember exactly where, but there was something
Yeah.
about if you
Move
move
the-
you move
Move
the blood,
get rid of the wind.
yeah, to get rid of the wind, you have to move the blood. That you can't.
I think it was actually in our stroke. It was in our
I
stroke.
also remember reading that.
Do you
I
remember?
do
I remember
remember reading
reading it
that.
somewhere, but it's totally lost to me as to where I read that.
I don't know if it was Bell's palsy or what it was, but there was something with one of our theory last year.
Yeah.
We had said that
With
if
blood.
you focus on the blood, like spleen 10,
Yeah.
bladder 17, that it would move the blood and get rid of the wind.
Yeah. So
Okay.
for treatment principles, then are we going to activate the blood or
Well, I
yeah.
think we have to reduce the heat. Because I mean,
reduce the
the
heat?
main thing is whether it's liver yang, we've got to obviously, if we're going to go with the hyperactive liver yang, I would say that you want to reduce the heat in the liver meridian. Am I right?
Yeah.
Yes.
Even if we maybe don't go too detailed, we can say reduce the heat and unblock or activate chi and blood circulation.
Right.
Yes.
That's what I would say. If you girls have got better suggestion.
No, that's I agree. And then I would say acupuncture only because you don't want to be using moxibustion on someone that's
Yeah.
got
Yes, for sure. Okay, so we
Okay, so
definitely said then acupuncture, reduce.
Reducing the
Okay.
heat.
Okay, good one.
Okay. And then if we're going with stroke, I mean, what points are we going to use? I mean, do 20 is like an pretty much
Yeah.
always used.
Yeah.
Do 20. I
And
would
it's
say
like
liver 3.
100%.
Yeah.
You could
And
also
when-
do kidney 3.
Kidney 3 to what? Balance the yin, to balance out the fire.
So yeah.
I think it activates chi, doesn't it? Maybe not. Sorry.
Well, the liver, yeah. So I mean, if you had, yeah, hyperactive. So the kidney has to nourish the liver. So maybe it's about nourishing the
I think-
kidney.
it
yin
could
to
be
balance the yang.
element theory.
And I would
Yeah.
definitely with exuberant heat, I have no idea if I'm correct at all, but I would definitely do large intestine 4 and large intestine 11 for the exuberant heat because that's
Yeah, agreed.
it's a well point. So
Yes.
do you guys agree?
I agree with that. Yeah.
So I would do large intestine 4, large intestine 11, and liver 3 as those ones to get rid of that exuberant heat.
Yes.
It's
And then the kidney
And then
3,
do 20.
yeah, and do 20.
kidney 3, yes.
I would
So are we
add
all
do
happy with those?
26 to that.
Yes.
Which
Sorry.
one?
I would add do 26 for your main, like just for the
But-
fact
but-
that it's a stroke, you add do 26.
But
Mhm.
isn't do 26 for when there's like loss of consciousness?
I was going to say, if they're unconscious. It
Okay.
is an idea, it is an option. Okay.
Let's quickly confirm. I just have in my mind do 26 for any stroke.
So you are
Like,
Yeah.
right, but I think do
I think
26
that
was
they
more
do.
for emergency because it's so painful. I think that they do
Okay.
26 when the patient is unconscious or having the stroke in an acute exacerbation.
okay.
I just pulled
Okay.
out some stroke notes, and they've got also points indicated for like the mouse deviation, upper and lower extremities impairments. Would we
Yes.
consider adding any of that? So like
Yeah.
large intestine 11 is listed as an impairment for upper extremities. And then for
Okay.
mouse deviation, they've listed here stomach 6 and stomach 4.
Yeah, that makes sense to do, because he was saying he's drooling, so there's definitely enough of a deviation at the mouth, and he said his tongue was deviated. So I think those are good points to add.
So
And-
then you
and
would do probably through needling for that, hey, to try and stimulate the paralysis of the mouth because of the drooling. Okay, that's a good one. So we'll say through needling, even though we've never done it.
You can do it Monday on me.
We'll
We
put-
can practice.
Yes, thank you. Thank you.
You brave.
Okay, what other ones did you, Marietta, you had one that you wanted to mention with 226. What was it quickly?
I wanted to say something like it's stomach 26, not 26, 36 to increase the blood, like to give nourishment so that there can be more blood made so that we can get rid of the wind. Or like a spleen 10, the
I was
sea
going
of
to
blood.
say activate blood.
Yeah,
Spleen 10
definitely
and yeah,
activate
bladder
the
set, yeah.
blood. Yeah, spleen 10. I like spleen 10 for that, and maybe we could
Okay.
do stomach with it. I'm not sure.
And Cecilia, did you want to make other suggestions for points? Sorry, you were still busy.
Oh, no, that was about it.
Okay, so then
Okay.
we're on the right track, eh?
And then also under treatment principles, I think we should say unblock meridians, because remember that a stroke is actually caused because there's a blockage to the meridian, right?
Yeah.
If it was a
It
blockage to
could
the
be.
Zangfu organs, then it would be loss of consciousness. So the fact
Yes.
that he hasn't lost consciousness, it must be blockage of the meridians.
Yes, I
So
agree
it
with
might just be, yeah,
So reduce heat, unblock meridian, activate chi and blood circulation.
yeah.
All right. So
And then
is everybody happy with that?
Yeah.
And then in terms of our prescription, we are going to do obviously then on the side of, because now remember the large intestine has switched over to the opposite side.
Mhm.
So then if the paralysis is on the
Yeah.
left side,
You do it
do
on the
we
right
then the right side large intestine
and
points?
4 and 11. I'm not sure, but that makes sense, yeah. The opposite side, so it's going to be on the right.
Yeah.
Okay.
But then wouldn't you need all the side? Would you do large intestine 4 or do you do bilateral? Regardless,
I would do
you
bilateral.
Because
Okay.
then do you understand? Because why would you needle then large intestine 4, large intestine 11 on the right side if there's paralysis of the left arm, because that meridian is still running there. But then if we're going to needle the points 2 and 6, that will help theoretically with the paralysis of the mouth.
Yes.
So I think we should probably needle the left side. Do you agree? Because the meridian is running still on that arm.
Yeah. I'm
If
not
we're
sure.
going to do the mouth points.
You mean that if we were doing it to do the face, then it would have to be the opposite side.
Yes, but we're not in this case. We said we'll do the 2 and the 4, 6 and 4. Okay,
So
then,
remember with large intestine 20, or it actually crosses the midline. The actual meridian crosses the
yes,
midline. So,
but we're
but
not
like
doing
the
20.
stomach meridian doesn't cross the midline; it stays on that side. So then I would
Yeah.
say needle
No,
the
I was just
affected
saying,
side.
yeah, but I'm just saying for the large intestine meridian, I was saying what side do we do? But I think we stick to the left side because it's on the left arm, and we're
Okay.
going to use stomach points on the left side for the mouth.
Okay. No, cool. Sorry. Yeah, I misunderstood you. Yeah.
No.
That's brilliant.
Okay, so
Okay,
large
so
intestine 4, large intestine 11.
Yes.
And
And
then
stomach
liver 3, would we do, are we all agreeing liver 3, hey?
Yeah.
I would do, and the liver 3
And we do
2
liver 3 bilaterally.
bilateral, and I might do the large intestine 4 bilateral as well. Because if we're trying to activate chi and blood, you want it to be, I would do both sides. The large intestine 11, I can understand one side, but maybe this one I would do, I don't
But
know,
even the
bilateral.
large intestine 11 will also get rid of the excess heat. So even bilateral, I think, but that one, we can confirm that with Dr. Who. When we do unilateral, bilateral.
Just the face one makes sense to do on the left
On the
side.
left.
Okay.
And then we also said, would we do kidney 3 and liver 3?
Yeah.
Yeah.
Okay.
kidney 3.
And they are going to all be perpendicular,
except for
perpendicular
the face.
insertions, except for
Yeah.
face. So face is horizontal,
Yeah.
horizontal 0.5 soon. And then with your large intestine 4, especially large intestine 11, you can go quite deep. Okay, perfect. Is everybody happy with that, girls? Are you all happy with our points we've chosen, hey?
So the stomach 4 through to 6. What size needle are we like? Do you literally go through? Do you need like a 2
Yes.
or 3 or something?
Actually, I actually don't know. I would maybe do a 1 soon or 1.5 soon, but we don't actually, we're not
we'll
very
reach.
clued up. Huh?
I don't think
1.5 soon. If you look at your thumbs, if you look at your soon,
but you're gonna. It's
right,
not gonna
yeah,
make it.
it can easily be, yeah, I can easily be a 2 soon. That's a good question. We don't know because we've never done through needling. We'll have to test.
Here's 3.
So that is
That's
2
3.
soon.
What's this? Is it 3?
Wasn't it 2 soon? Was
We
this
need
4
to go-
soon?
need to go back and look at our basics. Hold on, let me get my picture here.
Okay, I don't think he's worried about the soon. I think he wants to make sure we're getting the right.
Yeah, this is
We're getting carried away. We're
and
getting carried away. Yeah.
so it's about 3 for me. So I don't know. I'd use a long needle for that. But anyway,
1,
that doesn't matter. I mean, that's like a small.
3 soon. 4 fingers is 3 soon.
Hmm.
If you look roughly.
So
But we'll have to ask, okay? We'll have to ask that. Okay, so now we've got to do prescription explanation. Why are we choosing large intestine 11, large intestine 4, and liver 3? I think is to reduce the heat, the excess heat in the body. Do you all agree? Particularly, obviously, liver 3 would reduce the excess liver heat specifically.
yeah.
Yeah.
Heat.
Happy with that.
Plus,
And
it also, like Marietta or Cecilia said, it helps with paralysis of the limb, of the upper limb as well.
Yeah.
Which one? 11.
The large
Intestine
intestine 4
11.
and liver 3 are for paralysis and weakness of the upper limb.
Okay.
And then we say the stomach points are just because they're local.
Local. Yeah.
Okay.
And specifically used for deviation, drooling, any conditions related to the mouth. And I do know Shelley said that they did a lot of through needling for strokes and things.
Okay.
So I think it's quite a big one.
Yeah. And then
So
this
that's local.
spleen 10, that was just for activate blood, right?
Yeah.
Yes. For the blood stasis or get the blood moving.
Moving so that the wind will move.
And
Yes.
stomach 36 is that something we're gonna keep to stimulate the flow of chi?
Yeah, I think if you activate blood, they often
Blood
activate
chi will flow already
Because
because you don't
they
want to
go-
give too many points unnecessarily, hey?
Yes. Okay, so
Because
maybe
if we're
not that one
doing
then.
spleen, and we're doing liver 3, we already got 2 points on the leg, we've got 2 points on the head, we've got 2 points on the face.
Yeah.
So
okay,
you're
not that
treating,
one then.
what do you guys think? Would be good. It's good to ask Doctor Who, do we still do that, stomach? Because at the end of the day, stomach 36 will tonify all 3 of the yin,
The
both liver,
universal
spleen,
point.
and kidney. So it's maybe not a bad
Yeah.
idea.
It might be a good idea.
Maybe not a
Might be-
bad idea to add that. I think it's never a bad point to do if in doubt.
Yeah.
So we can maybe put that in stomach 36 to, what do we say? But then you're working from a tonification perspective, aren't we?
Yeah.
Yeah.
I suppose so.
Okay, let's put a question mark and we ask.
Yeah, are we allowed to ask questions or do we have to just tell them?
We don't know, we'll see. Possible risks, as always. The risks is always bleeding, bruising, fainting.
Yeah, bleeding, bruising. Okay.
Patient advice needs to go for a CT scan. Definitely needs to go to hospital. Needs to definitely. Do you
Yeah.
agree, all of you guys?
Yes.
Yeah.
Agreed.
Definitely.
And
Must go to hospital.
this do 20 that we're doing, I know it's a specific stroke point.
Yeah.
I don't know what to. Oh, it pacifies the wind. Okay, that's good. And subdues the yang. That sounds wonderful. Let's do
Oh, I
that.
forgot about D20. I forgot about it.
Pacify-
Yes.
Yeah, so under what I can look up, it says pacifies wind and subdues yang, which is exactly what we want.
Yes. Reduce
Okay.
yang. Beautiful.
Yeah. And I think either liver 3 or kidney 3 pulls the yang down, which you also want, right?
Yeah.
I think it is liver 3.
The liver 3. I wasn't sure which one
I
does.
think.
Okay.
Okay.
But,
Does anybody want to add anything else? Are you guys all happy with what we've got?
I'm
Oh,
happy.
okay.
that's
We
okay.
didn't write in now all the stuff Doctor Who wants is very specific. Chief complaints.
Yeah, chief complaint. So weakness on the left side,
Left-sided weakness.
starting 12 hours ago.
Left-sided weakness in arm and leg. For the last 12 hours. Is that correct? Do you agree?
Yeah.
Yeah.
I think
Left-sided
definitely
weakness in
timeframe.
arm and leg in last 12 hours. Present disease history.
That would be all the information we
questions
gathered
that
from
we've
the
written.
taking.
Okay.
I don't know if I'm allowed to read what I've written.
I also hope so.
Okay, thanks, guys. I think you're almost done.
Yes.
Okay. Okay, good.
I would need one of you to present the case. Saying what you said, you need to chief complaint, present disease history, and just what you discussed briefly to summarize.
Who wants to go?
I think we nominate Tammy.
I know. We nominate you, Marietta.
You only have 4
can't
here,
read
so
my own
you need to take
handwriting.
turns. And then at least we have 8
So-
simulation. Each of you need to have at least twice.
Doctor Who's tired of hearing Angel my voice. Okay, who's going to go? Where's Anne?
Where? What?
Oh, you yeah.
Me? I'm here. Of course I'm here.
No, I didn't see you.
I'm here.
Oh, okay. Okay, so who's going to go?
Okay, I'll do it, seeing as though nobody else wants to. How about that?
We did
Thanks,
it all
Angela.
together anyway, so
Hopefully I
whoever
can read- hopefully I can read what
presents
I've
it.
got here. Okay.
Okay.
All right. So this is a male patient, age 65, who arrived walking, but with a stick.
Sorry, chief complaint?
Okay, the chief complaint is left-sided weakness of his arm and leg for the past 12 hours.
Good. And directly go to the present disease history.
Okay, so 12 hours ago, the man reports having weakness of the left arm and leg while watching TV. He said that he had some drooling of saliva at the time. He reports having a slight headache, which is mild, a 2 out of 10 on the whole head. He hasn't been to hospital, and this hasn't happened before. His speech is unaffected. There's no numbness, pain, or tingling in the arm. He has no dizziness and no tinnitus. His eyes are not red, and there's no change in his taste. He's currently on hypertensive medication, which he takes daily, and the blood pressure is under control. There's no change in his thirst. His appetite was normal up until last night, but today there's a decrease in the appetite. His sleep is normal for him. Bowel movements are normal. There's no change in sweating. Emotionally, he said everything is normal. He hasn't been upset. There's no change in urination, and the urine color is a light yellow. There is deviation of the tongue. The tongue is red with a thin yellow coating, and the pulse is wiry. His diet is good. He reports having vegetables, meat, rice, and nothing oily in the diet. He's of normal build. Past medical history. He has a history of hypertension in the family, but no history of stroke. On physical examination, the Babinski reflex is abnormal or positive. Blood pressure is 120/80. Heart rate is 75. Temperature is 36.8. There's weakness of the muscles on examination. There's also a slight decrease in sensitivity on the left arm and leg and face. The diagnostic test that we would like to do is a CT scan. The diagnosis we came to was hyperactive liver yang, and Western diagnosis is possible ischemic stroke. The differential diseases that we looked at, transient ischemic attack, a brain tumor, brain aneurysm, and trigeminal neuralgia. Should I explain why we excluded all of those?
Yes, please.
Okay, so transient ischemic attack, it could still be that because that might resolve on its own in 24 hours and we're only at 12 hours. So that might still come into play here. The brain tumor, we would then have to confirm that on that CT scan. So that's also not excluded. Brain aneurysm, we decided it can't be that because that would have been a sudden fall down, probably loss of consciousness. And it can't be trigeminal neuralgia because it involves the arm and leg, not just the left side of the face. Pathogenic explanation. We said hyperactive liver yang, which causes exuberant heat, causing internal wind, resulting in blood stasis and therefore stroke. The heat symptoms that we saw were mainly in the tongue and the pulse, not so much in the case, because the tongue was red and the thin coating and the thin yellow coating and the wiry pulse. Okay, and then the treatment principles, we said to activate the qi and blood circulation, reduce the heat, and unblock the meridians. We said to do acupuncture only due to the heat and to do reducing manipulation.
You like your points?
Okay, so we said do 20 and large intestine 11, large intestine 4, liver 3, kidney 3, stomach 4 and stomach 6, and then spleen 10. And we were debating about stomach 36, whether we should add it or not, or if there's now too many points. But stomach 36, we thought possibly is a good point. Okay, must I add, must I tell you the different depths and angles?
No, it's fine. That's
Okay.
fine.
Okay, great. Okay, must I explain why we chose the points?
No. And what are your advice to the patient?
Well, to go and have a CT scan as soon as possible.
Anything else?
I think that was everything that we decided.
Great, thanks for the discussion and also the presentation. I think it's pretty good for the first simulation or for the case on stroke. And I think also from your discussion, especially from your discussion, I see you actually can self-reflect as a group. You can pick up most of the mistakes or some confusions when you have conflicts. So that's good because you know where it goes wrong. So these are the kinds of the internal reliability. So you can actually see these conflicts. So that's good. You can keep these as you move on, and then when you see the conflicts, you will know there's something wrong there. And just for the chief complaints grades, the perfect, and not just for the present disease history, 12 hours ago, is there any causes without obvious cause? Because the patient didn't know. So the cause is always important. Without obvious cause, the patient started to experience A, B, and C, the symptoms. And accompanied with mild headache and the location. So that's just very brief summary of all the symptoms at that specific time. You don't need to say
about the location of the headache.
No,
No,
we did. It was all
you
over
did the whole head. the whole
Yeah,
head.
Oh, okay.
So-
Okay, I missed that. I missed that.
So in your case writing, you don't need to write he said, he reported. You just keep the facts as simple as possible.
Okay.
And also the hypertensive medication, these actually related to the past medical history because hypertension not relevant to the stroke now.
okay.
It may be the risk factors, but this is not relevant to the current disease. So this should not be in the present disease.
Okay, so hypertensive medication we take out and put it under past medical history.
Yes, yes. And then still 12 hours ago at a specific time or at a specific spot, the patient started to experience all these symptoms accompanied with headache, mild headache, and what did the patient do? The patient didn't seek medical assistance. Okay. And then from 12 hours until now, is the symptom stable or not? So you said in the past 12 hours, the symptoms stable or progressively worse. It depends on your evaluation. And what's lack here in between is actually from your consultation, you didn't ask, but when I see your discussion, when I hear your discussion, you didn't know what you should ask because you actually exclude all those diseases, for example, hemorrhoid, hemorrhage, stroke. So for example, projective vomiting.
Yes.
And if this is stroke from heart attack, did this patient have heart condition before? If the clots from the heart and travel to the brain.
But I think I did ask Dr. Hu whether he had any cardiac history or history of stroke, or did I ask that about the family? Maybe it was the family
I think
history.
you
not
asked
his.
about-
You need to be more specifically because you don't expect the patient will be like educated, so they can help you to link these.
Yeah.
So when you ask more specifically, it's quite straightforward. You can ask the patient about, do you experience any chest tightness,
Chest pain.
palpitations, or shortness of breath? You see, these are quite straightforward to the symptom.
Yes.
And if you
Yes.
ask nausea, vomiting, projective vomiting, you see these
Yes.
are quite straightforward. And then I see in your differential diagnosis when you discussed, you did mention, so you didn't know these, but you need to write in your present disease history as the important negative symptoms from the timeline I gave you. These are the important negative symptoms. When you mention these, I know that along your consultation, you already exclude these diseases.
The referential diagnosis. Yeah. Yeah.
So we can now put those as the negative symptoms in this present history. Okay, great.
Yes, you can just say no after the positive symptoms, no projective vomiting, nausea, no chest pain, chest tightness, or palpitations. So
Okay.
you can mention 2 to 3, and then that's as the differential diagnosis.
Okay.
And then afterwards, you say in the past 12 hours, the patient did the symptoms stable or progressively worse. And then now you go back to now. Currently, the patient experience 1, 2, 3 the symptoms with tongue pulse and sleeping, bowel movements. That's all. That's all for the present disease history.
And you say that currently part before you do the negative symptoms, right? I'm talking for the order.
No, currently it's after the negative symptoms.
Okay, so you put it at the bottom. Okay.
So you need to see the group of symptoms and signs
You were
before
asking
the
what
current symptom.
had.
We're talking about 12 hours ago, not now. So you can separate the
Now you say
timeline.
currently.
Yes.
So then, Dr. Hu, how would we, if we've got now the chief complaint, we're starting now with present disease history and inquiry. So then would we start off 12 hours with no obvious cause?
Yes. What do you
And
need
then
another
you can-
chief complaint?
Then you're going to say weakness of left side of body, left sided weakness of arm and leg, drooling, mild headache, no hospitalization or medical care sought past 12 hours. You don't put there then past 12 hours seems stable because there doesn't seem to be any changes in his symptoms since he had the stroke and he's come to the doctor.
If there are
And
no
then-
changes, if there are no changes, stable.
Yeah. So past 12 hours, patient is stable. Then we're going to say the negative symptoms, and then we say currently, and then we say they've still got
No,
weakness.
the negative symptoms will will count before in the past 12 hours, the duration. So if you still remember the timeline, let me see if it's easy for me to find the
What
timeline.
happened? Because that's where we're getting a little bit confused how to.
Yeah, what to write first, yes.
I struggle with that still to see what is sort of expected in terms of its format.
Yes. You can see the key elements in consultation right now.
Yes.
Yes. So now it's 12 hours ago. So let's say that because this is not a long chronic disease, so you don't have 5 years ago now. You only start from here, 12 hours and currently.
Yeah.
You need to see this as block. So I want you to expand all these as a block and then move on to now. You don't mix. You don't talk about before and then for example, you don't talk about 2 weeks ago and then sometimes talk about between these 2 weeks and come back to 2 weeks ago. Because the negative symptoms still 2 weeks ago, you compare to that specific day.
But now, doctor, if it says here what happened, left-sided weakness, and then it says what are the current symptoms? Left-sided
Yes.
weakness, drooling, headache. But then the negative symptoms come now.
Right after the accompanying symptoms.
Okay. And then
Yes.
it's going to be sleep, appetite, tongue, and pulse. Is that
No.
the format you wanted on?
No. So you can see your present disease history will be what happens when, right? What happened 12 hours ago? What happens the weakness of the body? And the accompanying symptoms can be the drooling, can be the headache, accompanying symptoms. And then afterwards, the important negative symptoms is no dizziness, no vomiting, no chest pain, chest tightness. And then what did the patient do? The patient did not seek medical assistance. The symptoms stable. Okay, it's one group. And then afterwards, it said for these 12 hours, the symptoms stable, and then currently go to the next block. Currently now, what happens still, the patient experience 1, 2, 3, the weakness of the body, the left side of the body, drooling, and mild headache, 2 out of 10. These are the current symptoms. And then the important negative symptoms still the same, no of these. And
So
sleeping.
Am I understanding correctly? We're repeating, even though they're the same, we repeat them twice.
Yes.
Because you want them from when did it happen and what's it like now? Am I correct?
Yes. You can repeat twice. If you want to change those slightly, also can. Depends on the current symptom. For example, if because this case the patient does not mention any new symptoms from 12 hours compared to 12 hours ago and now. But sometimes if the patient have new symptoms here compared to 12 hours ago, and then you may add other negative symptoms for differential.
Okay.
But it's 2 blocks.
So you must keep the information separate.
Yes, because now when you diagnose and your symptom based on currently, not 12 hours ago.
Not 12 hours ago.
Okay.
And then why you need to mention 12 hours ago, you just want to see the development of the disease, the full development of the disease.
So that's why the sleeping, appetite, and bowel movement, tongue and pulse will only be in your current block, not in the before block.
If this is not insomnia, so you don't need, because how the patient sleep 5 years ago or 2 weeks ago it's not relevant to now.
Yeah,
correct.
We'll have to master that. That's still something I've got to try and understand and get used to writing effectively.
Yeah. So if you ask in this way, it's quite straightforward.
Yeah.
I think that before we move on, just review 1 or 2 things in your consultation is kinds of leading questions. So for example, when you ask question, you give options directly. That's why you said, for example, when you ask that the patient have any emotion problems, and then immediately you give the option, fight with the neighbors or fight with the wife, problem with neighbors. Try not to give options, because once you give options, the patient to choose.
Choose that option, yes.
Yes. Try to use open-ended questions if you can, and you can ask some closed-ended questions if you want specific answer.
Yes.
And there's one answer I gave you on purpose, and you still, I think you mix, is when you say hypertension. The hypertension, you can the past medical history, hypertension, you need to ask for how many years, for diagnosed hypertension for how many years, taking medication.
And who diagnosed? Obviously the GP.
Yeah, you don't need to, for here, you don't need to, for past medical history. If this patient come to you for hypertension, then you need to, where they diagnose.
Okay.
And medication, do you know the medication? If you don't know, unknown. And I said it's under control, but my under control is 160/90.
Yes.
So you need to clarify, it's under control, it's really under control or not.
How would you clarify that though? I mean, the patient's blood pressure on examination was, fairly normal. So if he says
Yeah.
it's under control,
Just ask them, do you remember the figures in general? Yeah.
Okay.
Sometimes they may, sometimes they may not know. But either way, you just have the habits.
So for our case write-up for handing it in to you, are you going to tell us how many years he did have hypertension, or are you going to leave it out?
You're going to make up the case. If you don't have sufficient information, make up the case. Even if you don't, even if you didn't ask in this session, you still make up the case by yourself.
All right. Okay. Okay.
And then also, if the, for example, one thing here is the sleeping, the patient mentioned the sleeping is not good in general, but since normal to the patient get used to the disturbed sleep. But the disturbed sleep, although it's normal to the patient, it also means something. Because this can expand from, for example, for your soldier, can expand from the heat. The heat disturbing the heart.
Yeah. And that the Shen is not in balance. The Shen is disturbed.
Yes. So although it's normal for the patient, but still means something for
Something there on chronic level.
to your soldier.
Yes.
Yes. And the CT scan is correct. And why we need to use CT scan now? And when to use MRI scan? Because I think you mentioned something in your discussion.
So with the CT scan, you would see a bleed right away, but you wouldn't see an ischemic stroke right away. But the MRI, I think an MRI might pick it up earlier.
Yeah. So the difference between these two is exactly the purpose for the CT scan at this stage is to exclude bleeding.
Yes.
The purpose for the MRI scan at this stage is to locate where it is the problem, with which area is located.
Okay.
These are important for the patient. That's why you can refer patients, but these are not that important for your treatment. So you don't stuck on here. This patient is ischemic stroke. That's correct, and your differential diagnosis is also correct. Your syndrome hyperactive liver yang with exuberance heat and then result in blastasis. That's too long, too complicated.
Okay.
But if you can expand from 1, then you expand from 1. If you can't expand from 2, if more than 3, which means you didn't find the root cause. Also from here, hyperactive liver yang. We have the terminology, the definition in the program. It says hyperactive liver yang we consider as deficient, right? The deficient fire. And liver fire, we said liver fire is excess. So you have the hyperactive liver yang and excess heat, the conflicts. You can't have deficient heat and excess heat at the same time.
Okay.
So for this case, the wire repulse, the red tongue with some yellow coating can be excess heat, can be the heat from the liver fire, and blastasis you can issue. Your explanation also can be in that way, but now why I want to show you the screen is I want actually type down the words you mentioned. Activating the qi, activates blood circulation, reduce heat, and block meridians. You need to keep the coherence between these two, the treatment principle and the syndrome and treatment principles. So if you diagnose hyperactive liver yang, you need to nourish liver yin and reduce heat.
Oh, no.
You can't diagnose here and then without anything here in the second part. Okay, you need to keep the coherence between the two. But as we said, we don't need this. But now when you have the activating qi and blood circulation, reduced heat on block meridian, now still you need to keep the coherence between the treatment principles and the acupoints. For example, do 20 you can, longitudinal 11 you can, and 4 you can to reduce heat. But why you use D2? Why you add kidney 3? Spin 10 still fine. You say that you activating the blood circulation. But why you have these? Why you add these there? Also, then the same question will go to why you want to add stammer 36. So if you keep
with chi, okay.
If you keep the coherence, then you actually will not, do you want to add these or not?
Yeah.
Stammer 4 to stammer 6, that's fine, it's because local, and then you can use local points.
Yes.
Sorry, Dr. Hu, somebody tried to phone me now, and then I missed out on the whole lot. Sorry about that. I was trying to get
No
back to the
problem.
meeting. My
Good.
apologies. What was
worries.
the syndrome in the end?
Also, we just emphasizing, so the syndrome is slightly too many, but that's not the issue because you will conclude to a briefer and more correction syndrome afterwards as your experience become more, and then you will conclude better. But what's more important here is the coherence between the syndrome, treatment principle, and the acupoints. So
Okay.
for example, when you have the excess heat here, or when you have the hyperactive liver yang, then your treatment principle, you need to tonify liver in. That's the coherence. You can't diagnose hyperactive liver yang and then just leave alone for your treatment principle. Okay. But for this case, this patient does not have hyperactive liver yang, that's why I deleted it. But from your treatment principle, these are all correct. Then you need to keep the coherence between the treatment principles and the acupoints. So do 20 large intestine, 220 is fine, the local, and also can activate the circulation. Large intestine 11 can reduce heat, and then this will go to large intestine 4, level 3, kidney 3. How does these contribute to your treatment principle? This the same question will go to stammer 36. How does will go to contribute to these? If you want to use stammer 36D, you must tonify qi. Otherwise, you don't. Kidney 3, you must tonify kidney. Otherwise, you don't. So you don't choose randomly.
Okay.
So the coherence between the
Treatment principle.
the syndrome and treatment principle and acupoints.
Yes.
True.
So
Okay, so we were
we
we were
saying
resting off acupoints, but they weren't applicable to our treatment principle.
Yes.
For our syndrome. So now the syndrome is liver fire, or and I'm lost now.
Liver fire.
Yeah, liver fire.
Liver fire.
Is that the definite one that you were looking for, Dr. Hu? Were you looking for liver fire?
Yes, liver fire for this case you can use because the wire repulse is related to liver, and the red tongue, the yellow coating can be fire.
And if we wrote exuberant heat?
That's still correct, but then not accurate enough because if you say excess heat, which organ? How are you going to treat? If from the stomach, from the lung, or from the liver, how are you going to treat the patient? It's not accurate enough.
Okay.
Yeah. And then when I
Dr. Hu,
mentioned,
can I quickly ask a question about the syndrome? So last year, the feedback that you gave me in the prac was saying that I couldn't make up my own syndromes. It had to be a syndrome that was in the notes underneath stroke, or underneath the condition. So if we're looking at the notes for stroke, there isn't necessarily just a plain excess heat. So when do I know I can use something like excess heat or deficient or something like that? And when do I need to be specific, like hyperactive young, or, in terms of that? Does that make sense?
Yes. That's a good question. So for your assessments, for the K6, you need to use the notes. For clinical practice, you don't. Because you see all these symptoms may not align with the syndrome from your textbook, because these can be for the real cases you can use, you can generate into appropriate syndrome, not according to the textbook.
Okay. Okay. So in this case, where the patient didn't specifically give signs of a specific heat sign or a specific, like there wasn't constipation or less urine or a deep red tongue or anything like that, then I can go with something more general, just saying heat because there's yellow in the covering of the tongue.
Your heat and liver, the organ, you always need an organ to locate into organ and then the excess or deficiency.
Okay, so
Otherwise, you won't be able to treat a patient.
Yes. And so from these symptoms that we had here, what would make us think that it was liver, just the wiry pulse?
So the wiry pulse, and also for stroke, is more likely to have liver be involved.
Okay.
Internal wind as well. The
But
fire.
then, can't we use liver 3 then as one of our points then?
Yes, that's a good question. If you think there's a liver fire, you will use liver 2, not liver 3.
Liver 2 for liver.
Liver 2 is seen spring points and reduce heat.
Okay.
Okay. Thank you so much, Dr. Hu. That makes it much clearer. Thank you.
No problem, thanks. And then for number 36, when you mentioned qi, and also in your discussion, the two things I heard. One is, will you diagnose this patient as deficient just from the weakness of the body? And the other is somewhere you mentioned phlegm or dampness, something like this. And you already self-corrected. That's correct. You cannot diagnose these as weakness as deficient. You cannot diagnose with phlegm because you don't have evidence. You need to base back to the case. You don't use the theory to generate something from the theory. You base back to the case, base back to the evidence. And then why I said the syndrome you can't use deficiency is because the weakness is not only from deficiency. The weakness can be from the blockage of the meridian, the move. And then, so that's the acupoints. The acupoints, apart from these, you need to link to the German principle. And also there's more, I would say more effective acupoints for stroke and stroke rehabilitation is 220 and HEART1. So you can write down this prescription. You actually can use this as the foundation prescription, and then you can add on other acupoints for the syndrome if you want to add. So that will be 226, sorry, not 220, 226, HEART1, large lung 5, or large intestine 11, pericardium 6.
What? 30?
GB for 30.
For the lower limb, paralysis of the lower limb.
Yes, and spleen 6. So this is a group of points only on the affected side. Because HEART1 is inconvenient to needle, so you can use one trim below HEART1. On the same meridian, just move lower to avoid the hair. And then apart from here, if you want to add something for the body constitution, you can add 1 or 2 points, don't add too many. These will be your foundation treatments for stroke and stroke rehabilitation.
Dr. Hu, so for instance, with this case, regardless, if we know then it's a stroke case, would we do these points regardless of the cause? Or do you want us to have lateral thinking where we use those points? If it is arm and leg, you use 1 or 2, but you treat the cause. In this case, it was liver fire. So we would do large intestine 4, large intestine 11, liver 2.
No, you can add on here in your clinical practice.
Okay.
And sometimes now, especially in the second year, sometimes you see these prescription, and sometimes you see how we treat patients in clinic may be different from your textbook. The reason because these are more effective compared to the standardized textbook. So, which means, for example, if in acupuncture therapeutics, if you ask you if in the short answers, the question I ask you, please provide the common syndromes and prescriptions of stroke, then you need to link that to a textbook. But if for case studies, then you can use these points. And also in your clinical practice, you can use these points.
And you would use do 26 even if the person didn't have loss of consciousness.
You can use, because this is quite painful as you mentioned, and sometimes I use alternating. So I don't use every single time. You may skip 1 or 2 days. And also lung 5, 11, and large intestine 11, you also can alternate. Because these tumor, because this is acute stage, you can see patients every day if they can afford. And sometimes even you can see the patient twice a day, in the morning and afternoon. So if you see patients that frequent and you don't want to use the same points all the time, so you can use 2 group of points. The techniques for this is especially for lung 5 and bladder 40. If you can use aggressive needle techniques of lifting and thrusting. If you can see the twisting of the geometry. So for example, if you have aggressive manipulation, the patient feel that this
Twitch.
twitch. If you have 2 or 3 times, then that's fine. That would be great.
So you want it to twitch because it's showing activation of muscles. It shows movement.
Yeah, so if you can achieve these, your result will be much better. And then this prescription in future, if you have the chance to see this type of patient, you can see quite effective sometimes. I see quite a few patients start to change within 30 minutes. From no movement to movement in 30 minutes.
Wow. Okay.
I saw one patient last year is the king of the Rudu, some smaller king from Durban. He came with a wheelchair and then he walked out after 30 minutes.
Wow.
So that's why these are quite effective.
Yeah, sure.
Sure.
Amazing.
And then go to the patient's advice. The patient advice you can refer, as you said, you can refer patient for the medical test to confirm the condition. But more importantly, apart from this advice, the general advice for the risk for acupuncture, you need to tell them. But more importantly, you need to tell the advice or you need to negotiate, discuss with the patient of the disease itself. Stroke in the acute stage, especially in 1 month, they have a very high chance to have a second stroke. You need to expand in advance, otherwise the patient will tell you, if you see patient every day, and all of a sudden in the second week, the patient have a second stroke. If you don't expand to them in advance, they're going to say that your treatment caused the second stroke.
Yes.
So in the meantime, you need to warn the patient with this from your content knowledge. And secondly, you need to advise the patient to monitor the blood pressure. Is to monitor the cholesterol, if they can, the blood sugar, these are all the risk factors. And then in the end, the frequency of treatments need to be in your prescription. You want to see this patient, especially for 12 hours. You want to see the patient every day, if they can.
How long would you do that for? Daily? For how long? 1 week, 2 weeks? Depends on the.
It depends on. So if you don't need to consider the financial cost, you will do up to 3 months.
Yo.
Daily. Wow.
And also for the 3 months, it's approximately, you don't need to. It's not a set of full course that the patient have to complete, because for most of the experience, it's after 2 months to 2.5 months, you will see less improvement. For the first first 2 months, within first 2 months, you can see improvement every single day. You can see the changes every single day.
Yes.
That's also why you don't want to delay the treatment. The treatment for stroke is initially, the treatment comes first. It's important. The frequency is important. Exercise is not that important. As the disease progresses, you're going to shift The treatment will drop, exercise is more important, and the exercise may need to last for a few years. They still can see some changes, but just not as significant as at the beginning. Especially for within the first month and until the first 3 months, we can see great improvements. After 3 months, although we said half a year becomes sequelae, but after 3 months, we don't really see significant changes.
So you've got to try and get it as quickly as possible.
Okay. Yes,
For
and
optimal results.
sometimes I discuss with the patient, if you plan to see me for 1 year, once a week, and for 1 year, for 50 times, for example, once a week, the 50 times a year, rather spend the money in 1.5 months and then stop seeing me for the entire year.
Yeah, makes sense.
Because for the same amount, you can gain the most recovery.
Yeah. Okay.
So how did we do that overall, Dr. Hu? Were we not too bad?
You get off?
Aside the wrong syndrome.
No,
Yeah,
that's great. I mean, the flow's great, and also for your discussion, you do have the content knowledge, and one happy with is you actually can self-reflect. When you discuss, you know where it's going wrong. That's why your conclusion is not too bad. So
Okay.
the difference from your prescription and the prescription I provided is you still can see some improvements, but just maybe just not as significant as, or just not as effective as the proper ones, but you're still on the right track.
Okay, we'll
Alright.
get there.
And then going back to those treatment principles, then if we're basing it on liver fire, then we
Yes.
obviously have to reduce heat.
Yeah. And then apart from these, for stroke, a patient with stroke, you need to ask the smoke. Does the patient smoke?
Right. Yeah.
We
Does the
didn't do that.
patient have alcohol intake? Like a drunk drink every day?
Yes.
Yes. So these are all the risk factors. Because you mentioned some hypertension, overweight. These are all
But
risk
not
factors.
lifestyle, besides
Yeah.
food. Yeah.
Yes.
So then what would the treatment principle be in this case? Would be to reduce, do you say reduce the heat in the liver meridian? Or do you just say reduce the
Reduce the
heat and
heat
block the meridian?
and unblock meridian.
Activate Qi and blood circulation.
Activate blood circulation. Not
Still do
Qi,
acupuncture reduce.
not Qi circulation, because if you want to activate Qi circulation, you need to diagnose the
Use
Qi stagnation.
Okay.
Qi stagnation.
So do we just say block the meridian? Or do we say activate blood circulation?
Activates blood circulation. So you need to always keep the coherence.
Okay.
In your assignments for this, and also your assignments in your clinical acupuncture when you submit, I'm not going to verify your symptoms correct or not according to your diagnosis or according to the symptoms. All I'm looking for is the coherence. Do you have the habits to keep the coherence? Because these are important. Your diagnosis of syndrome, you will improve gradually. As you have more experience, you can improve, but you need to have the habits. One after the other. You don't jump. You don't diagnose A and give similar treatment for B.
So are you saying, do you want our acupoints to correlate with the diagnosis, or do you want our acupoints to correlate with the syndrome?
The syndrome.
Okay, so even if the syndrome's wrong, you looking, what is our syndrome that we chose, and are they correlating with our acupoints that we treated the patient with?
Yes.
Even if we're wrong.
Yes, so that's for your assignments. But this is dangerous if you have this wrong in your the prex for that 10 minutes prec. Because if you have your syndrome wrong, everything wrong at the end.
Yeah.
Okay.
Just to ask about liver 2 as a point, if we're going to use it to reduce liver fire, do we prick to bleed that point?
You can use prick to bleed, or you can use reducing techniques, and you can use on both sides.
Okay. All right. Okay. Right. Good.
Okay, great. Do you have any other questions?
In terms of handing this in, do you want us to hand them in one at a time, or is it like we do 3 and that's the one assignment?
3. You can put 3 in one and then just upload on Moodle.
Okay, so we do 1, 2, 3, and then upload them as the first assignment. Okay.
Okay. So we take the case today and we write it up. And then we save it with the other virtual cases, and that becomes assignment 1. Am I right?
Yes, yes.
Okay.
Good.
Okay, great. Thanks, guys.
Thank
Okay.
you, Dr.
Thank you so
Thank you,
Thanks,
Dr.
everybody.
Thank you so
Have a
much,
good
Dr.
one.
Thanks.
Bye.
Bye.
Bye, bye, bye.